When women start to get to be in their 40s, even in their young 40s, and start having symptoms,
And it affects the brain and it affects the body, and they didn't know what that meant.
you want to make sure that you're getting plenty of calcium, plenty of vitamin D in your diet as well.
All right, doc, I don't know what menopause is supposed to feel. Is this right?
All right, everybody, welcome back to another episode of
What the?
What the Hell?
Oh, almost said something else.
With the Naaman Brothers. All right, guys, welcome back. So the topic for today.
Yeah, we talked about men's health, so we're gonna hit some women's health issues right now
sure.
again, and we're gonna go over to a topic we named. Is this a hot flash or is this a panic attack?
Yeah, or is she just losing her damn mind? No, I'm just kidding.
No.
Oh, wifey, I'm just kidding. I'm with you.
And this is something that comes up frequently, so this is one of the reasons why we're bringing it up right now. And probably start a little bit of history. Speaking of history, so hysterectomy, hysteria, again, because back in the day, voodoo medicine, before there was research and all of that stuff, that was felt that women who were histrionic, hysterectomy, hysteria, all came from the same thing, and a lot of it came from because, well, as hormone changes and things happen in life, things happen, and it affects the brain and it affects the body, and they didn't know what that meant, and so all of that was related to the hyst, and that's where you hear, and that's where all that first prefix comes from.
Right. So if the age range that we're going to focus on, like 40s to 50s, I mean, we should just kind of like maybe start. So like, whereas men generally don't have a whole lot of, like, even though we talked about like andropause or things like that, that's one of the things that's just kind of recently become like a more in vogue statement of things. Sure. That just kind of naturally, for women, we know that menopause,
guys basically just trying to blame it on something.
Right. Women, we know that it is a thing, and we talk about perimenopause, meno, and then postmenopause, and the actual true hormonal changes that happen, the impacts of through that time frame. But so we talk about premature menopause, meaning happening and or symptoms that start happening under a specific age. Meaning traditionally, if we start talking about, we just want it to be more medical based. If we start talking about under the age of 40, that's when we start saying like maybe there's something else going on. But really, I mean, when women start to get to be in their 40s, even in their young 40s, and start having symptoms of like maybe some hormonal imbalances of like mood swings, so maybe some vasomotor symptoms, and we say vasomotor meaning like having those flushes and flashes and starting to feel like maybe warm at times when like everybody else is sitting there freezing. And then having maybe all of a sudden now some irregularity with their menstrual cycles. Maybe they were normally either on a specific cycle, and then all of a sudden now it seems to be very irregular or becoming more erratic, and then kind of going through that phase.
Sure. And so that goes back to all of that whole concept around the menarche, right? So menstrual cycle, in other words. And the menstrual cycle, just like it sounds, it's a cycle. Not every woman goes through it because of several different reasons, right? Some women don't go through a menstrual cycle that's regular because they're on hormone replacement. Some women don't go through it, and it's because it's just off, and they have other conditions or things, whether it's thyroid or polycystic ovarian syndromes or whatnot. They then don't have a regular menstrual cycle. But those who do, or even if they don't, but now they're getting closer to that point of now their menstrual cycle is no longer cycling, it's now pausing, it's starting to slow down, it's starting to spread out more and more, and then eventually it stops. And typical age is around 50, 51 when women go through full menopause. And we get a lot of questions around, all right, doc, I don't know what menopause is supposed to feel. Is this right? And it's not necessarily that menopause feels a certain way. Many women go through it and they don't have any symptoms, but there are going to be some hormonal changes that happen to the body. And because of those hormonal changes, there are going to be changes physically as well as potentially mental health and psychosocial issues that will happen around the same time.
Sure. So we know for young women, before even starting as far as puberty, start with some basics. We've got the ovaries, and as the ovaries start to mature, they've got these follicles, and those follicles will go through cycles of like maturing and then kind of pausing and maturing and pausing, maturing and pausing, along the lines of like getting the female to a point where they could either get pregnant, and there's a certain number of, like, going back to what you were talking about with cycles, and as they start to get to be in a certain age in life where it's no longer really essentially a point in their lives where actually becoming pregnant is becoming a thing. But we can certainly talk about like that actually until they're actually done with menopause, they could always still get pregnant. So they have to be careful with that as well. And the risks that come along with like women who get pregnant in their 40s, potentially even into their 50s. That being said, those cycles that happen and those changes of like the ovum, the follicles and the ovaries maturing and not maturing, but getting to a point when we get to be in our 40s, or when women get to be in their 40s, where that starts to slow down. And when that starts to slow down, that also comes with a slowdown in the hormones that come from the ovaries as well.
So that's probably a good time now. So going from the biology or the physiology or how the body works, in other words, in terms of the menstrual cycle, but then eventually it does pause. And we get a lot of questions around. So maybe the next thing we talk about is specifically when women are asking us, well, is this a symptom I should be feeling at this point? Because we get a lot of that, right? So and maybe we can go over to some of those symptoms that women will feel or potentially could have during that perimenopause, menopause phase. What are some of those common symptoms that women can start to feel?
Right. So up until that point, when estrogen and progesterone are kind of going through their normal cycles from month to month, and they're having those kind of increase estrogen and then decrease estrogen and increase estrogen, or decrease or like progesterone that's kind of going along lines. As the estrogen starts to decrease, it's very normal to start to develop things like getting the flashes. That's the flushing and the vasomotor. It's very normal to
Let's explain it. So what flushing and vasomotor means as a symptom, for those who don't know, that really means that, again, you'll get flushed. You'll feel like, boy, I'm feeling like the heat is rising in my body, and you're expelling it. And then everybody else, like you mentioned earlier, they're fine, they're comfortable, but all of a sudden, all of a sudden you get this, what we call vasomotor. Really means that the blood vessels, the nerve endings at the blood vessels will constrict and dilate, and that causes, just like when you're outside and you get goosebumps and you're releasing heat, or when you're cold, right, you're going to retain heat. So those shifts inside the body are no longer regulated because estrogen is kind of again changing in their system. And because of that, you get this flushing sensation or this extreme heat all of a sudden.
Mm-hmm.
And so that potentially could be a completely normal symptom during this phase. But again, it also could be, especially if you're having it sooner or even later after you've gone through menopause, it could also be other things, thyroid conditions and other metabolic conditions, sugar.
Yeah. And people don't even realize that sometimes those flushing sensations could be manifestation of certain types of lymphomas and leukemias as well. So it could be even something more serious. So again, it's not everything is just like, oh, it's just a hormone release thing. And so there are some things that you have to kind of think about.
So if it's happening way too early or later than you expected, or if it's really happening in the period, you want to make sure that you bring that up to your provider, so that way we can get that other things checked out to make sure there's nothing else going on.
And so then during that phase, other things that we can mention is like with as estrogen, just like when we were talking about in our other phase, or other discussion topic, when low testosterone for men, when estrogen starts to drop off, estrogen is an important hormone for a lot of things for women. And as the estrogen starts to come down, what are all the negative impacts that can have on a female body?
Sure.
So what are all the things that estrogen does for women? So bone health, it helps heart health wise, psychological perspectives, it helps.
Right.
And then like for some of the area in the mucosal lining, so meaning like things like secretions. So then again, as estrogen starts to come down, we can guide women and tell them all the things to kind of watch out for all that.
Sure. So just like we talked about, testosterone is a steroid hormone, and it penetrates deeper into the cells to have its effect. Same thing with estrogen. So estrogen is going to be a steroid hormone that has a deeper effect on the brain, body, and muscles, and all of those tissues, including adipose tissues. So as it starts to fluctuate, and we've had a normal state, now we start to see it drop, it's going to affect their brain. So there may be more crying spells. That's where the whole concept of hysteria came in. There's more anxiety. But again, and it's going to affect sleep, which then can even exacerbate or even worsen that. So that means you got to be careful to make sure that, again, is that really your estrogen levels dropping around that period of time? Or is there something else, back to other hormones or other things that may be happening, like I'm just not getting good sleep because of other reasons? If that's the case, you got to come in, let's check those other things out. And if it is that, then yes, we can say that it's probably related to some hormone changes.
Right. So to go through the different body organ systems, so from our musculoskeletal, it's you increase risk of osteoporosis and osteopenia. That means the bones start to get thin. Muscle mass will start to diminish. Energy and strength will come down, just like for men with testosterone. The same thing for women. We look at like vascular heart health, because estrogen actually has some protective effects. Once estrogen starts to come down, then women start to kind of almost catch up to men in regards to the same risk factors for vascular heart disease.
Sure.
So we talk about bone strength and muscle mass, this heart health issues, psychological issues as far as like having more irritability, instability, having a hard time emotionally handling things, not sleeping as well.
Let's dive a little bit more deeper into that. So again, it's probably a good time for us to talk about, because we mentioned this quite frequently here during this talk, about the whole concept of how it affects the brain. And some of the things that, again, we hear a lot of questions around, okay, hey, I'm having more mood swings, or I'm having problems with anxiety, and I don't know what's what, and I'm constantly flipping back and forth. And, you know, and sometimes they'll even be told that, or they'll notice it themselves and they'll isolate, and they want to get back to this whole, no, everything's fine phase. So they don't communicate about it because they're trying to stay into that. No, I'm still in my 30s and my young 40s. This is not really happening. But we know, and they know that it is, but they're not bringing it up to anybody, and they're trying to struggle with what's going on and and they haven't put the pieces together. But mood swings and anxiety is a common thing from what we're hearing with the hormone changes.
Sure.
How can we potentially give some tips and tricks and explain some of the reasons being around some of those things, and what's going to be some ways that we can counsel around that?
Yeah. So I mean, it always starts out with just the basics. Number one is exercise routinely. Number two is make sure that you're getting a well balanced nutritional meal. That's you're eating a good balance, like Mediterranean diet, keeping the calories down, doing weight training exercises that are good for resistance, that are going to put a little bit more impact on the bones, so that way bones will stay strong, stay healthy. You want to make sure that you're getting plenty of calcium, plenty of vitamin D in your diet as well, because that's an important thing to help keep bone strength up as well. Just figured out, throw that in there while we talk about that. Making sure you're getting proper rest, proper sleep, in social circle wise, and making sure that you've got yourself with the proper, support as you're kind of going through these, these more challenging times where the hormone levels are starting to drop down, and it's truly where there's physiologic chemical changes happening in your body. It's not just like one of the things that.
So yeah, so women, so you're not crazy. This is really happening. This is going through, and there's some chemical changes happening, which is impacting the way the brain, serotonin receptors, and other parts of the brain, and how they actually, the way they were working before, are not the way they're going to work right now. You're going to go through these things. So, but this is great tips. So some of the things that you're saying is that, okay, if you haven't been exercising or getting good sleep before, it's imperative that you start these habits now. Because that's going to be one of the biggest things. Lifestyle changes, like making sure that you're getting your 8 hours of sleep, way more important now than when you were 30.
Sure.
And then, of course, if you weren't exercising before, because of how other hormones or pro-hormones like vitamin D impact with the estrogen changes, this is a great time for increasing your resistance training exercises. So this is either body weight or actual weight type exercises is what you're going to want to do. A, it's a natural stress reliever. B, it's going to help to impact the bones, but it also has a calming effect on the body. And then because we're trying to get more blood flow to the brain to counter the acts of the lower estrogen, we're going to want to do more of those types of exercises that'll get brain. So that's going to be your cardio as well. So if we improve just some of those lifestyle things and put more emphasis on it, it'll help. Now, is it going to completely take away? No. And if you're noticing it to the point where it becomes a quote unquote disorder, meaning it's impacting how you are acting with family or at work, then that's when you want to talk to a provider, so that way we can start doing other things that potentially can help with that. Again, now we're talking serotonin, hormone,
and
things.
Also, to mention some of the things that for years when you and I were first, out of residency, where a lot of the Women's Health Initiative trials and et cetera, that were kind of like where things were really leaning towards or away from us to use HRT or replacement therapy, which thankfully, a lot of that has kind of debunked in regards to that. That probably was a lot of just misinformation and disinformation in regards to from the way the studies were interpreted. And we're now understanding that actually hormone replacement therapy, using estrogen. Getting estrogen levels back up for women is actually a very good thing and very protective, and not as bad as we were led to think that it should be.
So let's dive deeper into that, because that's something that we're going to really want to make sure that we're addressing for everybody, is going to be hormone replacement therapy, supplements, and what is worth trying during this period of time. It's a key thing, because we are seeing more and more women right now are looking at, supplements, and how do we actually take in supplements that are going to be beneficial for for me at this age with these types of symptoms. And as you mentioned too, we see a lot of misinformation that was pushed out there because of how people interpreted the results of studies. And because of that, women who could have benefited from HRT or hormone replacement therapy, especially now these bioidentical hormone replacement therapies, at one point they could have benefited from it, and now we're seeing that they were being pushed away, and they actually should be taking some of these things.
Right. So for all the women out there who are in this age range, if you're feeling symptoms, you definitely want to talk with your physician, or come on in and talk to an Epic Health provider in regards to, talking about hormone replacement therapy if you're in that right age category and you're having the right symptoms, because it can help with a lot of the symptoms we were talking about, a lot of the hormone withdrawal symptoms that we're talking about. Going back to some of the other things that, women in this age range, it's also now we're starting to see where you're at an age range in life where certain health issues start becoming a little bit more, I guess, prominent. And so that's when we start talking about like the prevalence and statistical analysis and incidence. So we see where things like cervical cancer, breast cancer, colon cancer, all those kind of things start becoming a topic.
And I think that's one of the reasons why women were not taking it, because they were worried about the effects that hormone replacement therapy was going to have on breast cancer specifically, because some of the earlier studies that came out, and then the way the media pushed out that, there was a higher risk in this, but it wasn't really statistically significant to the point where population health should have stayed away from it. Now we know that actually women in this age range who are having symptoms, and what are those symptoms? Well, if you're having problems with your libido, if you're having problems with the hot flashes, if you're having problems with vaginal dryness or pain during intercourse, these are all things that, again, if you're having those symptoms, hormone replacement actually could be or you're starting to change in terms of the way your body shape is, muscle mass. We know that these are all things that potentially can be improved on with hormone replacement therapy.
Right. And in addition to the vascular benefits and all, when we talk about like estrogen itself, is the positive effects it has on vascular disease or health. So like, yes, decreasing risk for atherosclerosis, improving lipid profiles, all these kind of things that we know that like hormone replacement therapy can help, that we were essentially for a long time being misinformed in the way that the studies were initially like being purported. And when we went back and kind of sliced and diced it a little bit more, realized, and then looking at, even in more additional studies, that again, hormone replacement therapy for the right female, because there are sometimes there's some instances where some women who are not candidates for it, for instance, they've got a strong family history of like breast cancer or a personal history of something like that. But even with a personal history, it depends on the individual. There might still be some.
We've us and our OB-GYNs in our group, they'll prescribe it even for those women who've had family history after they've done their history taking. They'll go through and they'll still add it. If you've had your own cancer, breast cancer, then may not be an option for you, but it still may be. So that is on hormone replacement therapy. We touched about it a little bit, maybe a little bit deeper. Now we can talk about some of the things in terms of how important it is, and with all of these shifts going on right now around sleep, intercourse, and again, just mental health. What can we do? Maybe a couple tips and tricks around that, and how important all of that is together around this time.
Yeah, well, the other thing too is I feel like we spend a lot of time focusing on hormone fluctuation changes, because that is a big part of women in their 40s and 50s. Is like very centered in a lot of the discussions, a dialogue, but it's also a common time frame where things, again, just like we were talking about with our episode of talking with men's health. You've got teens, adolescents, 20s, 30s, and then you get into 40s. That's years of probably unhealthy eating, unhealthy lifestyle, probably not exercising like should. And that's also when things like blood sugar problems start to creep up. Cholesterol issues will start to creep up. And women, because of the estrogen protective effect, we don't tend to see as much of the bad stuff like heart disease at a younger ages. Women tend to trail men by about a decade. So meaning when men will start developing issues in their upper 40s and 50s, women are a little bit later than that, but it doesn't necessarily mean that we don't see that now at this point. So it's important to make sure that like this is the time frame where we really want to make sure we're watching for things like blood sugar, cholesterol, blood pressure, watching the body mass index. Women tend to hold their body weight and body fat in different regions that are maybe not as, I guess, problematic or inflammatory, creating or not creating as much of the inflammatory mediators as with visceral adipose tissue for men, but it can still happen for women as well.
Sure.
So again, it's screening for cancers, because this is a time frame when things start happening. Still screening for all the other metabolic and all the other health issues that start happening, especially as the estrogen levels start to drop. All the social, emotional things that come with estrogen loss, but it's still a time in life where it's middle life and, there's changes. Children are older now if they've had children. Their parents are starting, are aged and, probably starting to have more issues. And we know that men we're not good with like helping with those kind of things. Usually most of that stuff falls on the women.
Maybe you. My wife tells me I'm great with it. Well, so those are all important reasons why, again, you just mentioned in terms of coming in and getting your check-ins and getting all of those different things tested on a regular basis because of all of those different shifts. But let's talk about a different topic now in terms of some we call the S's, the sleep, sex, and staying sane. All right. So at this age range and when we're going through all of this stuff, how do they actually do all that? But they're all kind of related, again, because you're going to start seeing changes in libido. You're going to start seeing changes where, again, libido is still high, but boy, it hurts if there's vaginal dryness. And so then sex may be affected. And if you start noticing those kinds of things, this is a good time to bring in when you're getting your check-ins that you just talked about and all those different checkups, making sure that we're checking those things out. Now, if that does happen, though, again, first thing we just talked about, you got to get checked out because it may not be hormonal. It may actually be something else going on and that we need to check into. Is there something going on in terms of like potential other hormone changes, or is there, like you mentioned, cervical cancer screenings and other screenings that we need to do at that age range as well. There may be some changes in terms of the pelvic floor if they've had children and they have to get tested. So make sure that, again, we're getting those gynecological testing if some of that stuff is going on with intercourse. But back to, again, part of that is when you're starting to see those changes, like you mentioned, psychosocially, first and foremost, back to your habits. Got to get that sleep. We can't say it enough in terms of like, got to make sure that you're getting solid sleep during this phase.
Yeah, and a lot of times I'll get asked oftentimes in the exam room, like, what kind of supplements should I be taking? As a general, I always tell everybody, if you're going to be taking supplements, you want to make sure that you're taking ones that are either age appropriate or geared towards what it is that you're trying to achieve. So right now we're talking about, for the majority, again, going back to the 80-20 principle you're mentioning, multivitamin, is always a good thing. But definitely at this age range for women, you want to make sure that you're getting plenty of calcium and plenty of vitamin D in your diet, because that's very important for bone health. So when we talk about calcium, about 1,200 milligrams to 1,500 milligrams of calcium a day.
Right.
And the vitamin D, that goes back and forth forever. It depends on like where you live, how much sunshine you get, whether you're getting vitamin D naturally through sun exposure, which ideally would be anywhere from 20 to 30 minutes of direct sunlight and at least 10 or 15% of some uncovered body area daily. But generally, for most of us who live further away from the equator, we don't get a whole lot of that.
So 70% of the U.S. population is going to be deficient in it. So then you're going to want to, but that goes back to the word. It's a supplement. You're adding to what you're supposed to be taking. It's not replacing.
Right. And so, go anywhere from 400 international units, even up to 1,000, even up to 5,000 international units, depending on how little sunshine you get for the vitamin D supplement. But that's one of those where, getting periodic checks. I know that a lot of times the plans are always pushing away from doing vitamin D levels, but again, it's one of the things where if you're not getting a whole lot of vitamin D sun exposure, then you want to make sure.
Such an important pro-hormone that I don't think it gets enough attention.
There's anything that worsens menopause? So that's a great question. So there's natural menopause, and then there are abrupt and potential chemical induced menopauses, and then there's surgical induced menopause. So when we talk about menopause, we're really talking about a drop in estrogen levels in the body, and there's a bunch of different ways it can happen. Number one, there's natural ways that can happen just with time. If anything that can impact or influence ovarian production of estrogen, and so stress could potentially even be a risk factor. Other external, I guess I would say chemicals or medications could potentially do it.
Mm-hmm.
And there are a lot of them. Some of them are purposeful, meaning there are sometimes we'll actually give women medication. For instance, like some women who maybe have a certain form of breast cancer, will actually purposely give them medications to induce what we call chemical menopause. Some women who, for instance, have some issues where that they're having a hysterectomy and or they've got some issues with the ovaries where we need to take out the ovary, they immediately go like abruptly without estrogen and they go through what we call surgical menopause. So for them, it's actually very problematic because it usually goes from like 0 to 60. Like one day you have estrogen, the next day you have no estrogen. And for those women, it's like, that's like you're talking about like going in one of those like demon drop things. They go from like, from 0 to 60 of like no estrogen immediately.
And they feel it.
Right. And that's the part. So then we, it depends on what the issue reason and why we actually induce them into a menopausal state. Sometimes it was like we're purposely trying to take away their estrogen and they essentially abruptly go into menopause, which is usually very problematic. I mean, most women that I've seen with that, they have a horrible time for several months as their body adjusts to having the lack of estrogen. We try all kinds of things to at least control some of the psychological and the vasomotor, meaning some of the symptoms that like have like the hot flashes and the flushing and all those kind of things. We can actually give medications to block a lot of those effects. We can also give medications to try to help improve the mood and the affect and all the psychological stuff. But when we have to purposely cut some estrogen or females estrogen purposely because of breast cancer or some other reason to cut off their estrogen and make it abrupt, it's usually very problematic.
So how do men support their partners? Number one, you got to know that it's happening. That's a big one. So a lot of times what happens in this age range, as I mentioned before, is that what ends up happening is that the women are a little bit of, I'm going to get through this myself and I'm going to start to try to do things and improve it on my own. And they don't communicate. So the partner has no clue it's even happening. And so then now there's arguments and then it just, again, there's more issues psychosocially with the partners. So first and foremost, it's you got to be aware and then be receptive to it because again, you're going to have all these, you can't say, oh, it's not happening, it's in your head, or or it's just hormonal and you got to get over, that's not helpful. So a lot of that comes back to taking things off their plate, making sure that again, they're getting into good, healthy habits, being supportive around that, knowing that again, hey, you got to be careful. It depends. You got to know your significant other. So you're not going to tell them, hey, do you really want to take that spicy food because it's going to make you hot flash, or hey, you don't want to, because that doesn't always go over too well. So yeah, don't tell them what to do. Ask them how you could be helpful. So women in midlife, they go through so many different things. We talked about a bunch of these things. So again, thank you for staying tuned, for being part of this session on What the Hell.
Hopefully everybody learned a little bit something for the women out there who are in the 40s and 50s, and welcome. And we're happy to have you here at What the Hell.